Have you ever looked down at your arms and noticed something odd? A darkened patch, a bruise that lingers, a yellowish tint that just won't fade? Most seniors brush it off. It's just old age, they say. But what if it isn't? In many cases, these subtle skin discolorations are early whispers of something far more serious. Early signs of liver cancer. It's silent, it's slow, and it often hides behind symptoms that seem harmless. In this video, we show you the warning signs from the smallest things and how your skin can say more than you think. Subscribe and turn on the bell to receive thoughtful insights rooted in elderly wisdom, motivation, and senior health. One of the earliest and most visible indicators of liver distress is jaundice, the yellowing of the skin and the whites of the eyes. This occurs due to the accumulation of bilirubin, a yellow pigment formed during the breakdown of red blood cells. A healthy liver processes and removes bilirubin efficiently. However, when liver function begins to decline, whether due to chronic liver disease, fatty liver, hepatitis, or cancer, bilirubin builds up in the bloodstream and starts to deposit in tissues, including the skin and eyes. In elderly individuals, jaundice may develop slowly and subtly. Many seniors mistake the yellowish tinge for fatigue or attribute it to poor lighting. However, jaundice is more than a cosmetic change. It is a biological alarm. The appearance of yellowing on the arms, face, and chest often means liver cells are under severe stress. If untreated, the condition may progress, signaling either chronic damage or early stages of malignancy within the liver. Persistent itchiness is another symptom often associated with liver dysfunction. Unlike surface-level itching caused by dry skin or allergies, liver itching typically has no visible rash. It stems from the accumulation of bile salts in the bloodstream, byproducts that the liver can no longer filter properly. This type of pruritus tends to affect the limbs and back and often worsens at night. It can disrupt sleep, contribute to anxiety, and reduce overall quality of life for seniors. Because it does not present with inflammation or redness, many elderly individuals dismiss the symptom or self-treat with topical creams that offer no relief. Itchy skin without cause should never be ignored in a person over 65, especially when paired with fatigue or digestion issues. The liver is also responsible for producing proteins essential to blood clotting. When liver function deteriorates, the synthesis of these clotting factors is impaired. As a result, seniors may begin to bruise more easily, even after minimal impact, and minor cuts may bleed longer than usual. Bruises that appear without obvious cause, especially on the arms and hands, can point to compromised clotting ability. These may start as small purple marks but can expand over days. The underlying condition, whether cirrhosis or cancer, often remains hidden unless this visible symptom is recognized as a red flag. In elderly patients with a history of liver issues or long-term medication use such as blood thinners, this sign should prompt immediate medical evaluation. Reddening of the palms, known as palmar erythema, is another often overlooked symptom. It's typically symmetrical and affects the fleshy areas on either side of the palm. This sign is believed to result from changes in hormone levels, particularly elevated estrogen, which the liver normally regulates. When liver function is compromised, hormone clearance becomes less efficient, leading to vascular dilation and skin discoloration. While palmar erythema is not painful or disabling, its presence in seniors should raise concern, particularly if accompanied by fatigue, nausea, or weight loss. It is a quiet but important clue in the diagnostic puzzle of liver disease. Small, spider-like clusters of dilated blood vessels under the skin, known as spider angiomas, can also appear, particularly on the arms, chest, neck, or face. Their presence often indicates elevated levels of estrogen, a hormonal imbalance associated with liver dysfunction. In healthy individuals, the liver helps maintain hormone balance by metabolizing excess hormones from the bloodstream. When the liver is damaged, estrogen levels may rise, resulting in vascular changes. These marks are typically red with a central dot and radiating lines. Pressing on the central area usually causes the radiating vessels to blanch temporarily. In elderly populations, the appearance of multiple spider angiomas can suggest chronic liver disease or progression towards cirrhosis and warrants further investigation. Dark patches or a bronze-gray skin tone, particularly on the forearms, shins, and joints, may signal a buildup of iron or melanin, common in liver dysfunction. Hemochromatosis or prolonged inflammation can cause the liver to accumulate and redistribute pigments abnormally. Discoloration is gradual and often mistaken for age spots or sun exposure. However, systemic hyperpigmentation, especially when accompanied by fatigue, joint pain, or abdominal discomfort, may indicate liver disease. For seniors, particularly those with metabolic syndrome or diabetes, this sign deserves careful clinical evaluation. Although most fluid retention in liver disease presents in the abdomen or legs, swelling in the arms and wrists may also occur. This symptom is caused by hypoalbuminemia, low levels of albumin protein, which the liver produces. Albumin helps regulate oncotic pressure in the blood. When levels drop due to impaired liver synthesis, fluid begins to leak into tissues, causing puffiness. In older adults, this symptom may be confused with arthritis or cardiac issues. However, when seen in combination with other liver signs such as fatigue, itching, or jaundice, it may signal advancing liver impairment. Monitoring limb swelling, particularly in seniors with pre-existing liver conditions, is critical for early detection and management. These skin manifestations may appear benign, but often reflect significant internal dysfunction. In elderly populations, where symptoms tend to be less dramatic but more chronic, the skin becomes a window into hidden systemic issues. Understanding and recognizing these changes isn't just clinical, it's part of respecting elderly wisdom, paying attention to lived experience, and honoring the subtle ways our bodies speak as we age. This is the essence of Elderly Reflections: to translate senior health signals into motivation, inspiration, and action. When we listen closely to these small signs, we uncover life lessons from the elderly that can make all the difference. Understanding the deeper causes behind skin changes in seniors is a journey through a complex and interconnected biological system. Liver cancer and many liver conditions do not emerge overnight. They often evolve silently, developing in the shadow of other chronic illnesses or imbalances that erode liver health slowly over time. This is especially true for seniors, whose aging bodies must contend with decades of metabolic activity, medication use, nutritional shifts, and immune changes. Each of these factors, one of the most common long-term contributors to liver cancer, is chronic viral hepatitis. Hepatitis B and C in particular are often undetected in older adults because the infections can lie dormant for decades without causing symptoms. Blood transfusions, dental work, or even minor surgeries before the 1990s may have exposed individuals unknowingly. As the virus replicates slowly over years, it causes chronic inflammation in liver tissues. This persistent assault promotes fibrosis, the gradual buildup of scar tissue, which eventually disrupts liver function. When fibrosis advances to cirrhosis, the risk of cancer increases dramatically. In many elderly patients, by the time symptoms appear on the skin, the disease has already reached a stage that demands immediate intervention. Equally significant is non-alcoholic fatty liver disease, NAFLD, a condition now considered the most common liver disorder in developed countries. It is tightly linked to lifestyle and metabolic dysfunction, particularly obesity, insulin resistance, and type 2 diabetes. In NAFLD, extra triglycerides accumulate within liver cells, initiating an inflammatory cascade that leads to non-alcoholic steatohepatitis, fibrosis, and eventually cancer. For seniors, these conditions are insidious because the liver often continues to function without obvious signs until much of its regenerative capacity is lost. What makes NAFLD particularly dangerous for the elderly is its silent nature, combined with its progressive potential. Many seniors with skin hyperpigmentation or unexplained fatigue may in fact be experiencing late-stage manifestations of this condition. Alcohol liver disease, ARLD, remains a prevalent risk factor among older adults. While moderate drinking may have seemed harmless earlier in life, the aging liver loses efficiency in processing alcohol. In the elderly, even lower average alcohol consumption can lead to accumulation of liver fat, oxidative stress, and immune-managed damage. Long-term drinkers who never exhibited liver symptoms before may suddenly develop jaundice, itching, or bruising with little provocation. Additionally, alcohol compromises gut integrity and increases systemic inflammation, two factors that make the liver more susceptible to injury. For seniors, skin signs such as red palms, vascular spider angiomas, and facial flushing may be early indications of a liver overwhelmed by alcohol's cumulative effects. Polypharmacy is another underestimated but significant driver of liver distress in aging populations. Seniors often take multiple medications daily, ranging from blood pressure drugs and cholesterol-lowering statins to over-the-counter painkillers and herbal supplements. Each of these compounds passes through the liver, For metabolism, the liver's detoxification pathways, particularly the cytochrome P450 enzyme system, can become overloaded or impaired, especially when drugs interact with each other. Reactions such as drug-induced hepatitis or cholestasis may not present with immediate liver pain, but rather with skin symptoms like persistent itch, yellowing, or rashes. Moreover, liver enzyme elevations often go unnoticed until blood work is ordered for unrelated reasons. The risk is even greater for seniors with underlying liver conditions or reduced albumin levels, as drug binding and distribution in the body become unpredictable. Iron overload, particularly hereditary hemochromatosis, is another major contributor to liver damage in older adults. Though it is a genetic disorder, many individuals do not show symptoms until late middle age or senior years. The condition leads to excessive absorption and storage of dietary iron, which gradually deposits in organs like the liver, pancreas, and heart. In the liver, this iron acts like a slow poison, creating oxidative stress and damaging. The resulting tissue damage sets the stage for cirrhosis and eventually liver cancer. Skin manifestations such as a bronze or grayish tint are hallmark signs of hemochromatosis in seniors. Unfortunately, this pigment change is often dismissed as sun damage or natural aging, causing critical delays in diagnosis. Autoimmune liver conditions, such as autoimmune hepatitis, primary biliary cholangitis, PBC, and primary sclerosing cholangitis, PSC, represent another class of hidden threats. These diseases occur when the immune system erroneously targets liver cells or bile ducts, causing chronic inflammation and fibrosis. While they may begin with vague symptoms, fatigue, joint pain, or abdominal discomfort, they frequently progress without aggressive intervention. Seniors are particularly susceptible to underdiagnosis because these symptoms overlap with other common geriatric complaints. Skin signs like palmar erythema, dark patches, or vascular changes may be the first visible cues of an autoimmune disorder. Disrupting hepatic function? These conditions require immunosuppressive treatment and vigilant monitoring, as they significantly raise the risk for liver cancer if untreated. Hormonal shifts that accompany aging also have a direct impact on liver function and, by extension, skin appearance. Estrogen metabolism, for instance, is closely regulated by the liver. As estrogen levels rise or fluctuate, particularly in postmenopausal women or men with testosterone deficiency, skin may exhibit signs of vascular fragility, such as flushed cheeks or red palms. These changes often go unaddressed unless they are accompanied by other symptoms. But for clinicians who understand the hormonal liver connection, such signs can offer early clues to deeper endocrine or hepatic imbalances. Nutritional deficiencies further amplify these risks. Seniors often struggle with appetite, chewing, or absorption, leading to low levels of protein, vitamins, and antioxidants. Vitamin D deficiency, for instance, has been linked to liver fibrosis progression. A lack of B vitamins can contribute to impaired metabolism and increased homocysteine levels, which exacerbate inflammation. Free deficiencies in zinc and selenium affect the liver's ability to neutralize free radicals. When nutritional gaps combine with chronic disease, the skin often becomes one of the first places to show distress, through dryness, rashes, and discoloration. Malnutrition also contributes to reduced albumin production, weakening the liver's ability to maintain fluid balance and protect tissues. Environmental toxins, such as industrial chemicals, pesticides, and even prolonged exposure to air pollution, can quietly accumulate in the liver over time. Seniors who worked in factories, on farms, or in urban areas decades ago may now face the consequences of this exposure. These toxins burden the liver's detoxification pathways and provoke immune reactions that further degrade liver tissue. When the organ is overburdened, skin signs such as rashes, eczema-like conditions, or hives may develop. Though these are often treated symptomatically, their root cause may lie deeper within hepatic processes. Even psychological stress has an underappreciated role in liver health. Chronic stress activates the hypothalamic pituitary adrenal (HPA) axis, increasing cortisol and inflammatory markers. Prolonged elevation of these chemicals interferes with digestion, immune regulation, and liver enzyme balance. Seniors dealing with isolation, grief, or anxiety may not report physical symptoms, but their liver can reflect this inner turmoil through unexplained fatigue, digestive complaints, and subtle skin changes. Addressing mental well-being through counseling, group engagement, or mindfulness can help restore systemic balance and reduce liver strain. To understand liver skin symptoms in seniors is to read the layered history of a person's life, their diet, exposures, relationships, medications, and stressors. The liver is more than an organ of detoxification. It is a mirror of one's cumulative experience. Skin discoloration, texture changes, or vascular anomalies are not random. They are messages waiting to be decoded. When these signs appear, especially in the elderly, they must be interpreted with compassion, curiosity, and urgency. In the context of elderly reflections, every skin symptom becomes part of a broader story. It reminds us to see the elderly not just as patients, but as storytellers, offering insight through the language of their bodies. When we honor that language, we not only improve senior health, we elevate the conversation around aging itself, turning quiet signs into meaningful dialogue between patient, provider, and community. When the body begins to whisper, through yellowed skin, persistent itching, or unexplained bruises, listening can mean the difference between healing and harm. For seniors, these signs should never be treated as mere nuisances or inevitable consequences of aging. They are messages urgent, precise, and personal. The first act of care is attention. That means noticing a change in skin tone, a discomfort that lingers, or a mark that won't fade, and acting on it quickly. Seniors must be empowered to trust what their body tells them and consult their physicians without hesitation. Liver function tests, blood panels, ultrasounds, and even advanced imaging like MRI or CT scans are critical tools that can detect issues long before symptoms escalate. And for those who already have liver conditions, regular checkups are not optional. They are essential. But vigilance does not end at diagnosis. It begins anew. Once identified, liver health must be supported holistically. Diet plays an enormous role. Seniors often face challenges related to appetite, dentition, or digestion, but these hurdles should not deter balanced, nutrient-rich eating. A liver-friendly diet emphasizes fiber, lean proteins, healthy fats, and an abundance of colorful vegetables and fruits. Avoiding saturated fats, refined sugars, and processed meats is just as important as including antioxidant-rich foods like berries, leafy greens, garlic, and turmeric. Hydration cannot be overstated. The elderly are more susceptible to dehydration, which compounds hepatic stress and limited detoxification. Setting regular reminders to sip water or incorporating hydrating foods such as cucumbers, citrus fruits, and soups can help maintain proper fluid balance. Movement is medicine, especially for the aging liver. Physical activity helps metabolize fats, improve circulation, and reduce inflammation. Seniors don't need to engage in strenuous workouts. Simple practices like walking, stretching, Tai Chi, or light yoga can dramatically improve liver function and overall well-being. Group activities not only encourage physical health, but also offer social engagement, which is itself a protective factor. Again, sleep must be safeguarded. The liver performs most of its restorative work during nighttime hours. Seniors who struggle with insomnia or fragmented sleep may be robbing their liver of essential recovery time. Strategies such as maintaining a consistent sleep schedule, reducing screen exposure before bed, and using calming rituals like herbal teas or meditation can support deeper rest. Equally critical is medication management. Polypharmacy is a well-documented challenge in senior populations. Many drugs, whether prescribed or over-the-counter, are metabolized by the liver. Seniors should work with their healthcare providers to review every pill they take, from cholesterol medications to pain relievers. Where possible, simplifying or substituting medications with safer alternatives can reduce the liver's burden. Alcohol, even in moderation, should be avoided. The aging liver lacks the regenerative capacity of its younger counterpart. Seniors who drank casually for decades may be surprised to learn that their current consumption, though unchanged, now poses a far greater risk. What's often underappreciated is the role of the mind in healing the body. Chronic illness, liver disease included, often comes with anxiety, depression, or emotional fatigue. Seniors should be encouraged to acknowledge and express their feelings, whether to a therapist, a support group, or simply a trusted friend. Emotional health directly impacts physical resilience. Practices like journaling, prayer, gardening, or music therapy offer powerful outlets for stress and can foster a renewed sense of purpose. In many cultures, elderly wisdom is revered not only for its knowledge, but for its calm. Reconnecting with that inner wisdom helps seniors frame illness not as a defeat, but as a chapter. Family and caregivers play an irreplaceable role in this journey. A caregiver who learns to recognize skin changes, who encourages hydration and healthy meals, and who ensures medical appointments are kept, becomes a frontline defender of senior health. It's equally important that caregivers offer emotional support without infantilizing the elderly. Seniors must be seen as active participants in their care, not passive recipients. Their voice matters, their story matters. That's the spirit of Elderly Reflections. Community connection amplifies healing. Seniors benefit greatly from structured programs that combine health education, physical activity, and peer support. Whether through local senior centers, church groups, or digital platforms, these networks allow individuals to share their experiences, ask questions, and feel less alone in their journey. Education is empowerment. When seniors understand what their symptoms mean and why their doctor recommends a particular change, they are more likely to follow through. Technology can be a quiet hero in this process. Wearables that track hydration, sleep, or heart rate, pill dispensers with reminders, and telemedicine appointments allow seniors, especially those in rural or mobility-limited settings, to stay connected and proactive. But these tools must be made accessible. Families and communities should take the time to teach and support the adoption of helpful tools. Most importantly, we must all return to the idea of listening. Listening not just to lab results or symptom lists, but to the stories and observations of the elderly themselves. Too often their concerns are dismissed or minimized, yet they are the ones who live in their bodies. In responding to skin changes as signs of potential liver trouble, we do more than treat symptoms. We validate lived experience. We promote dignity. We reclaim health through awareness, action, and empathy. And in doing so, we pass on something powerful. The reminder that growing older is not a fading away, but a deeper unfolding, a chance to reflect, adapt, and thrive with all the wisdom that age brings. The body speaks long before it breaks. For seniors, especially those in their 60s, 70s, and beyond, this truth is more important than ever. Strange skin discoloration on your arms, persistent itching, unexplained bruising, none of these should be dismissed as mere signs of aging. They could be quiet warnings of deeper issues, including early-stage liver cancer. But the good news is this: when caught early, many liver conditions are manageable and even reversible. At Elderly Reflections, we believe in the power of observation, the strength of listening to our own bodies, and the value of passing on life lessons from the elderly. Our skin doesn't just shield us, it signals us. To the caregivers, families, and seniors watching, stay alert, stay informed, and don't hesitate to act when something feels off. Your vigilance could be the difference between delay and timely care, between hardship and healing. If you found this content helpful, please leave a like and subscribe to our channel. Your support allows us to continue creating senior health content rooted in elderly wisdom, motivation, and true stories. And don't forget